Welcome back, everybody. We are excited that you're back as we continue our conversation related to technology. Artificial intelligence, I know, can cause many colleagues to be uncomfortable, even with that concept sometimes. We introduced in our last session, our last snapshot, some really important opportunities and threats associated with what we like to call assisted intelligence. And in this snapshot, we're talking about gamification. So, what strategies should you use really to help our students learn, to fully engage them on that learning journey that David Cope talks about? Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurse educators to achieve excellence in the classroom, in the skills lab, in the actual clinical setting, and to also help colleagues achieve that passing score on the CNE exam. First step is to print out the study worksheet. If you haven't already, you want to make sure that that's printed out every time you're here reviewing content on our channel. The second step is to pull out Billings and Halstead. You want to focus on chapter 14 in the 6th edition. The reason why we're still using the 6th edition is because that was the resource that exam writers use to write the current exam, and this is 2025. All right, so depending on when you watch this snapshot, there may be an update. All right, and now we're going to go ahead and jump into our content. We do have our thought-provoking question, just like we always do, that we'll make sure we answer before we end our time together today. So gamification, what is it? Why should we use it? And how do we truly turn those lessons of fun and excitement into learning, right? We don't want to just create these fun and exciting experiences for our students. We want them to be intentional. We want them to be purposeful as we look at how they align with our learning objectives. So what is gamification? Well, it's an experience that we engage our learners in to help them really retain nursing concepts and to understand some of those basic concepts as well. We also want to incorporate gaming elements to help motivate and obviously keep the learning exciting for our students, right? Make it more enjoyable, make it more memorable for our students. So when they get to questions on the NCLEX exam, or if they're faced with a challenging clinical situation, we hope that they will refer back to the learning that they engaged in with us during the gamification, during the simulation, so that they can make safe patient care decisions. It also encourages collaboration amongst peers, fostering that sense of community that we know is essential in nursing education. All right, and if you haven't already, go ahead and write down today's date. Okay, so whatever date you're watching the snapshot on your study worksheet, and what is an objective? Now that you know what we'll be talking about in the snapshot, I want you to reflect on what is it that you still have so many points about, and what is it that you want to walk away having a better understanding about as a result of spending your time here today. Time is our most valuable asset because once it's gone, we can't get it back. So this is our thought-provoking question. When selecting instructional technology for classroom use, which consideration most closely reflects evidence-based practice in nursing education? So we have A, student preference for mobile apps over lecture-based formats. B, ease of access and downloadability for both faculty and students. And C, research that supports improved learning outcomes through multimedia integration. Step one, think about what is this question really asking me? When you get to the CNE exam, in the stem of the question, there may be a distractor, there may be a scenario, there may be a statement. Remember, 70 to 80% of the questions on the exam are going to be at that application and analysis level, that middle level of Bloom's taxonomy. When you look at pages 188 through 190 in the 6th edition, this is where you're going to find some deeper explanations. Hopefully, you'll have deeper clarification regarding the 3 learning domains and how we should engage learners to learn at every single level. Scaffolding of learning happens when we're able to draw from prior knowledge to help our students advance their knowledge and their skills all the way up to the very top of that specific learning domain. Remembering that every learning domain has its own taxonomy, okay? So lowest level is going to be the least challenging, right? That lowest level of learning up to the very top, which is that highest level of learning and comprehension. All right, so hopefully you've had time to kind of write down your answers. And I want you to also think about, why are the other two options not correct? Okay, so when you get to the CNE exam, there will be three options. Only one of them will be correct. You will have 150 questions and you will have 3 hours to take the exam. Now, we always recommend that you test at a learning center. You have options, right? There's still an offering for remote testing, but the reason why we really encourage you to test at a center is because you're going to have a proctor on site. You are not going to be responsible for any tech issues that come up, right? Because you have a proctor. That's not the case if you decide to test in your home or if you decide to test at a university. Okay, so that's the reason why. Now we want to talk a little bit about the history of gamification. So back in 2010, yeah, it's not new. This is when gamification was actually introduced. It was a way for us to engage students in a very fun and exciting way, but also to help them with knowledge retention. And then 2014 and 2018 is where you see this rise. In 2014, some date even sooner, this is where we saw simulation specific for nursing students. Now we know in the aviation area, they started gamification many years ago, some cite in the mid 1900s. But in nursing, specifically nursing education, we really didn't see it till early 2010 and 2014, as it states here. And that's when simulation was more realistic, aligned with those clinical scenarios. And of course, we continue to improve. In 2018 is where we saw more mobile learning applications. And then in 2022, as well as through currently 2025, we're continuing to see even more gamification as it relates to assessments, and it increases our students' motivation and competitive spirit. So one good example is with Jeopardy, right? We're seeing Jeopardy as a gamification, and we're seeing Kahoot, Slido. Those have been around for a while. We like to use Poll Everywhere here at Dr. Sellars Educate, but we know there's many different ways that you can gamify and create those innovative technologies to help engage our students in the learning process. So what's your number as it relates to using gamification in the learning environment to promote and support competency one? Do you feel like you're lost as far as having knowledge about technology and how it aligns with evidence-based practice? Or do you feel like you're a 5, that you're ready to teach about concepts related to this topic? All right, so 1 to 5 is where we want you to kind of place yourself, doing a little bit of self-assessment. 85% of students report increased retention through gamification. This statistic really highlights the effectiveness of interactive learning. Okay, so we want to focus on how can we keep students engaged to support the learning process. We want to engage in formative assessments. So we're finding out from our students as it relates to their knowledge throughout the process, how are they learning? Does it make sense to them? If it doesn't make sense to our students, I just want to stop sharing for a second. Let's see if I can, there we go. If learning using gamification doesn't make sense to our students, then it's ineffective. Okay, so we want to make sure that we focus on the learning journey with our students. We don't want to leave them behind because we're so heavily focused on the gamification that we're using. And it does take more time when we are moving forward on this journey of integrating innovative technology. It is more time consuming. So what is it that you want to do? Take 3 simple steps. Number 1, identify just one technology that you want to integrate into your learning experience with your students in the next semester. Okay. Second step, identify an expert that can help you along the way. Hopefully it's internally, but whatever resource you have available to you, who is going to be your champion? Who is going to be your supportive person to help you integrate this technology? Step 3, gather feedback along the way. Okay, so don't wait until you have gone through the entire semester of using gamification to get feedback from your students, right? You want to get feedback continuously. That way you know what you need to tweak. Maybe it's just that the first time students struggle with it, and by the third time, it was much easier, okay? So step number 1, identify one technology you want to integrate, new technology. Number 2, find a champion to help you, resources available. Number 3, gather that formative feedback along the way so you don't have to wait to the end to determine, was this gamification effective or not? Okay, those 3 simple steps that you want to think about as you explore advanced technology to ultimately help our students learn. All right, what is it that you want to focus on next? Well, there's 3 different categories of gamification strategies that we want to talk about. Number 1 is going to be simulation. You probably guessed that. It allows our students to practice those real life scenarios, right? We want to use it as formative feedback because we want students to have information about their performance along the way so they can make adjustments and ultimately make safer patient care decisions. Second area that you want to focus on or strategy is going to be those interactive quizzes, right? We know that quizzes are important to give us formative feedback about whether or not students are learning, but what about making them more interactive? We like to use Poll Everywhere. We like to use heat maps. You can even use a priority or ranking system in the different technologies. Poll Everywhere does allow for that so that it can be learning and feedback in real time. So interactive quizzes is a great way. Adaptive quizzing is another strategy that many nurse educators use. And then case studies, unfolding case studies, interactive case studies are going to allow our students to develop that deep thinking, right? That critical thinking, that clinical judgment that we know students need in order to draw from their previous experiences and apply that knowledge in future clinical experiences. Okay, so simulation, interactive quizzes, or adaptive quizzing, and case studies are 3 gamification strategies that you want to use. All right, so how did you do? Okay, on that scale of 1 to 5, take some time to really reflect on what is that one technology, that one gamification system or strategy that you are going to integrate into your learning experience the next semester, and then act, right? We want you to identify the champion, right? Step 1, identify the gamification strategy. Step 2, identify champion and resources that can help you. Step 3, gather that data along the way so you can determine what was effective, what was not so effective. All right, so our thought-provoking question, if you chose C, give yourself a round of applause. Research that supports improved learning outcomes through multimedia integration is the correct answer, and this is the rationale. Evidence-based teaching requires incorporating strategies that have demonstrated positive learning outcomes. Chapter 14 in Billings and Halstead, 6th edition. While user experience and preferences matter, educational effectiveness based on research is essential to competency 1. Okay, so you can go back, take a look at what was this question really asking me? Okay, and then what is it that you knew for sure about concepts related to this question? When you look at student learning preference, yes, we want to consider that, but what was the question asking? Which consideration most closely reflects evidence-based practice in nursing education? So mobile apps over lecture-based formats, there's no research that says that's true, right? That we need to or should look at that as a strategy or as a decision maker when it comes to instructional technology, because we still want to engage in that human element where we're still connecting with our students to find out any muddy points that they have to support them in using that technology that we've integrated into the learning strategy. And ease of access goes back to the learning curve. We know anytime we're using technology for the first time, there's always a learning curve, but what are the resources we have to support us? Using technology can be overwhelming. There's no question about that. And you don't have to do it alone. When you're on the CNE journey or the Nurse Educator Excellence journey, we want you to join us. Go into our website, drsellars.educate.com. Joining us in our community through our monthly boot camp is an excellent way to not only earn continuing education credits, but also, second of all, to have a community of support. Our mission at Dr. Sellars Educate is to support all nurse educators on the journey to achieve nurse educator excellence. We are here to support you until you are successful on the CNE exam, and we look forward to seeing you in a future snapshot. Have a great one, everybody.